I did want to ask a little bit on just kind of the access to support services. I think, Enrique, you mentioned PRP and doing your IOP via telemedicine and televideo. And Megan, you talked about your peer recovery kind of folks doing outreach in between their medical visits. I think a lot of our patients are struggling with that kind of access to group visits and access to counseling. And in the same way they're having less face-to-face visits with us, they're having less face-to-face visits with their therapist or psychiatrist. What are you seeing in terms of resources that are helpful for your patients in terms of doing it virtually? Have you found the virtual IOP to be something people are connecting around? Or Megan, are you finding these kind of connections in between your visits more helpful than just kind of like the monthly check-in that you're having? Kind of what's your experience on that counseling support piece?
I found, so for the patients that have internet in the room has been really helpful, and peers I work closely with have said when they use it personally, and patients who are able to access it we're pleasantly surprised that it provides more support and more group support than they would have thought. And then it's the flip side for some. So mental health has been hard, and that's a lot of what we are trying to use the active case management and CHWs to help patients know where they can get in. I will say for the patients who have internet, particularly of CCP, who previously had transportation barriers, there's people who are able to access mental health that weren't. And they are finding that even for a phone call, even short phone calls from the peers and from our outreach team, patients are really happy about. And we're able to connect them with the supports. And I think just knowing that someone's checking in on them, they're really appreciative of. So I would just say, even if it's really low tech with your patient, finding ways to do more frequent touches, if you can do it on a weekly basis, is really helpful. And then at least because you're getting rid of some of the other logistics, you can do a lot of quick back-to-back calls where with normal community outreach going in person would be harder to do that.
That's great. Enrique, did you want to chime in?
Yeah, our IOP attendance is actually higher than it's ever been. And I think part of that goes to, and it's helped me kind of really recognize how many barriers our patients face to get care. So when it's being done over televideo, they don't have to think about transportation. They don't have to think about money for their transportation. They may be able to, they don't have to find childcare. A lot of our patients who are employed, say, their boss will give them 30 minutes to do a group and get treatment. And that's, they're more flexible than as opposed to if a patient needs to take 3 hours to, take 3 buses with 2 transfers, and it's, from start to finish, it's half a day to get one service. So, even though we lose that kind of in-person, element, to televideo and, this telecare eliminates so many barriers that I think that's what's driven our numbers to all-time highs.
I think that's really great to hear, because I think one of the questions that I have then kind of as a follow-up to that would really be, we've had all these suspending of regulations, we've had dramatic changes, we've all been forced to kind of accept audio only, telehealth video visits, doing some more frequent touch points with our patients, even when they're stable, and finding kind of pleasantly that some of the patients wanted that and were seeking that. Are there things you see that have happened as because of COVID-19, either on the mental health front or your addiction care, where you feel like this is kind of something you're going to continue going forward, that you hope to kind of solidify these workflows and maybe kind of keep this kind of level of engagement for your patients? What do you guys think?
We definitely plan to continue to have video visits, particularly at CCP. I think for the van, it's a little harder since it's audio only. But one thought, especially we have people who travel quite a ways, including from Pennsylvania, the Eastern Shore, Western Maryland. And so thinking about even reinstituting laboratory monitoring, but at a community lab ahead of the visit, and having ways where we can minimize, or you might alternate in-person and telemed visits. But we're really happy to have the option. And so I think it will be a hybrid model going forward for us.
I think the other thing just to add is that, this is one of those big lessons learned, from this crisis, and that while, these remote, whether it's audio, visual, or phone only, is never probably going to replace in-person visits, that it does really supplement and make it easier, I think, to kind of stay connected to people. And so having those in-person visits may not necessarily need to be as frequent. And, having made some of the some phone calls and, reaching out to patients, not only now, but even before this, I do think that sometimes patients, they don't necessarily expect that their treatment provider is going to, call them, outside of the office, but they really, they like it, and I think it is kind of a way you get additional information, even if it's not in a face-to-face, personal visit. You can really kind of get a lot more of information around how they're doing outside of the office, how they're doing kind of perhaps at home, what all the noises are in the background, all of that. So I think it's something that I don't know that, we have, I think we've always kind of assumed that people really don't want to hear from us as providers, outside of normal, quote, business hours. But I think we're kind of all finding that may not be true.
Yeah, I would like to see a hybrid model, moving forward. My first thought is, our stable patients, our monthly patients, allowing them to do televideo appointments, and our more unstable patients, my instinct is to let's bring them into the office so we can, make sure they're getting all these, wraparound services. On the other hand, we always preach, meeting our patients where they are. And if we have a patient who has $5 in their pocket, and that $5 is either going to be spent on bus fare or feeding their family, and they have to make a choice, I don't want them to have to make that choice. So if having a televideo appointment means they get care and they can feed their family, well, that's meeting the patient where they are. So I think there's a lot. I think as long as this is done in a thoughtful way, and that there's checks in this hybrid system, I think it can be very successful and a very positive thing for patient care done right.
That's excellent. I think those comments from each of you, I think, kind of lets us end on a slightly hopeful note, which is great. We only have a few minutes left, and I just want to thank everyone. I think the response in terms of attendance and everyone joining in has been amazing, and kind of exactly what we hoped for, is kind of bringing ourselves together as a community during this time. I do want to make sure that we're going to send some follow-up resources later this week to everyone who's participated. So kind of keep your eyes open for communication from us at MedSAM. Our education committee is meeting tomorrow, and this is kind of our way of kind of